Hi, this is Dr. Keefe at MMPC, and I would like to take you through a test patient and demonstrate how you can meet meaningful use objectives. So to start off, I want to introduce you to this little red triangle, which pulls up the encounter summary. By having this encounter summary as part of our electronic health record and using it, we've already met one of the criteria, which is implementing a clinical support rule. And so we're doing that. And when you do pull it up, you'll see a number of items that need to be fulfilled for meaningful use. And they have the red letters MU next to them. Smoking status not documented, patient does not have problem list, etc. And just to demonstrate on another patient, this patient only has 2 of the criteria that haven't been met. So if you look at this with each patient, you'll see what needs to be done. So going back to my patient, what I can do if I choose is to fulfill some of the meaningful use objectives right here from within the encounter summary. And I'll do a couple. Smoking status is not documented. I click on it, right click, and this patient was never a smoker. So I've added that to their problem list. If I would like to do their problem list here, I might click on the problem list, right click, and I'll say that this patient has no active problems. And that's an option. You just have to maintain an up-to-date problem list. If the patient has no active problems, you just need to document it. Now, some of these in the encounter summary you can't use as a means of adding the data. For example, blood pressure. If I click on this and right click, it doesn't give me an option to add blood pressure. So for starters, I'm just going to use the encounter summary for these 2 meaningful use objectives, and then I'm going to act as if I'm seeing this patient in the clinic to fulfill other meaningful use criteria. So I'll hit continue. So I'm going to go to this patient's clinical desktop, and I'm going to act as if the patient is coming into my office for a visit. Now keep in mind, the physician does not need to enter all these meaningful use criteria. This can be done by either the physician or support staff. So when a patient comes into your office, you're typically going to check their blood pressure and vital signs, and that indeed is a meaningful use criteria. You have to check their height, weight, blood pressure, calculate and display the BMI, which will happen automatically in Allscripts if you do put in the height and weight. And so we'll go ahead and do that. We'll click on the red heart, which pulls up your vital signs. I'll just enter in this patient is 6 feet tall, weighs 190 pounds, has a blood pressure of 120/80, and a heart rate of 70. And you can see when I go to my vital signs, those blood pressures will be in and the BMI is calculated right in the right lower hand part of your screen. I'll go ahead and hit commit. The next thing I may want to do is enter in the patient's allergies. So I'll go to my allergies section and I'll click new. If the patient has no allergies, you do need to document this, and keep in mind this is only medication allergies. If they have an allergy to dust or cats or pollen, that doesn't count here. It's medications only. So I'm going to put in no known drug allergies. Click OK. And then this yellow button here is the reconcile button. I'm going to go ahead and reconcile. Next, I'm going to put in their medications. And again, patient may not be on medications. That's okay. You do need to document it. So for this patient, I'm just going to click the box, no reported medications. Click OK, and then reconcile. Next, I want to go in and create an electronic problem list. And you can see here the only one in so far is the smoking status, which we entered via the encounter summary. So I'm going to click the new button. Similar to the medications and allergies, we actually did already put in that this patient has no active problems, but I may want to put in their past medical history of breast cancer, past surgical history of a hernia repair, family history of cancer, and I may want to put in their social history that they're married, exercising regularly. I'll click OK. So I've now entered a problem list. I've put in the patient's medications and reconciled, put in their allergies and reconciled. I've documented their vital signs, BMI, their smoking status. I've used a clinical support tool, and let's see what we have left. So when we click on the encounter summary, we have that the language, race, or ethnicity is not documented. That's a meaningful use criteria, and I'll show you how that can be done. The other important meaningful use criteria is this transition of care, which is down here at the bottom. The transition of care signifies that the patient has moved from one clinical setting to another. So this can be from the hospital to the outpatient setting. It can be from surgery to the ambulatory setting. It can be from one provider to another. It's really what the physician signifies is a change in their transition of care, and when you do click the transition of care, you need to be certain that the medications are reconciled, which we're going to do anyways. So I'm going to go ahead and click the transition of care box. And I'll just note for you that the transition of care is also listed here in your schedule, TC. So that's another place where you could click the transition of care. Now to the race, language, and ethnicity. That is something that can either be entered by support staff via your practice management system or by clicking this blue I button. So it's right next to your encounter summary, right there. So if we move down, we will see these boxes pop up for language, race, and ethnicity. Now the government has signified that for ethnicity, there's really only two options to click, either Hispanic or non-Hispanic. So you have to pick one, or if the patient actually declines it, you can say declined. If you put not reported, that will not count for you in terms of fulfilling meaningful use. So we'll say non-Hispanic. Race, we'll put white, and this is something you would ask the patients or have them fill out a form to signify. And we'll put it in English. And click Save. So when we look back here, we now have no meaningful use criteria. Now I just want to signify, although I didn't prescribe a medication electronically in this patient, I will go in and I'm actually going to prescribe a medication. So we'll give them Aldactone, 1 tablet daily. And we'll click record. I'm not sending this to a pharmacy, but suppose I had. You can see that the no active medications is now gone, and they do have the spironolactone as a new medication. Now, when I go to this patient's charges, I just want to remind you, if this is for these patients, in addition to billing them for whatever problem you're seeing them for, their COPD, and you're putting in their visit charges, you also want to put in that you prescribed a medication electronically, this G8553 code. Okay. So finally, after I've done all this, I've put in all the data, we need to provide the patient with a clinical summary, and that is this CS column right here. And I'll click on it, and just to show you what it looks like. So it has their assessed problems, their medication changes. I prescribed spironolactone. It has their vital signs, their current medication, which is just spironolactone, the fact that they have no allergies. Okay, and I would just print that for the patient. Actually, I'll print it to, just print a PDF. And you'll see that you get a checkbox in the clinical summary. Okay, so next I just want to show you, and this attachment will be provided for you, the meaningful use objectives. That's frustrating. So for these patients, we use computerized order entry for medication orders. That was the aldactone we provided. We have the drug-drug allergy and interaction checks. That's automatically happening in all scripts. You see that when you prescribe medications. We have an up-to-date problem list. We've demonstrated our ability to prescribe medications electronically, and I showed you where that code sits. We've maintained an active medication list. We have an active allergy list. We put in the demographics, language, gender, race, ethnicity, date of birth. That's all in there now. We've put in the vital signs. We've recorded smoking status. This reporting of ambulatory clinical quality measures to CMS, that's something that MMPC has been asking you about, which ones you would like to report, and that will happen automatically behind the scenes. We've implemented a clinical decision support rule with our encounter summary. The clinical summary, number 12, I showed you how to print. You need to give that to 50% of all your patients. I'm sorry, that's number 13. That's your clinical summary. Number 12 is providing a patient with an electronic copy of their health information. That's something that MMPC is working on, and we will let you know kind of how and when we can do that. Number 14, we can exchange key clinical information with other providers, such as hospitals. We're doing that. And 15, we can protect electronic health information. So just through seeing that patient, we've now met meaningful use criteria for that patient. And if we make that part of our workflow, both in terms of physician and staff workflow, you will meet your meaningful use criteria. Thanks a lot.